Hi, is your dengue fever on and your platelet count has dropped and now you're wondering whether it is dangerous, whether you need to get admitted, what are the possible things that could happen because of a low platelet count? I'm Dr. Bhargav Rao from Pathofast Lab in Pune, and we test the platelet counts as well as the dengue test for a number of patients over the years. I'm going to answer all these questions, including what level of dengue platelets is dangerous, to how much do your platelets have to fall before you really need to start worrying, and is it something for which you need to get admitted. I'm also going to answer questions like when do you need a platelet transfusion, do you need to consult a doctor at what level, and what are the possible other signs that you need to look for. Let's start with what is dengue and what are platelets. Dengue is a viral infection which is transmitted to human beings through the bite of the female Aedes aegypti mosquitoes. This is a viral infection which causes a fever, a very high initial fever which lasts for about 3 to 7 days, and thereafter most people recover on their own. Platelets are normal cells which are present in every person's blood. Their main job is to basically cause clotting of the blood. For example, whenever you have a small cut or a bruise, the platelets are responsible to make sure that the bleeding does not continue from that site. Dengue has a deleterious effect on platelets. It causes platelet numbers to fall, and it also causes platelets to actually destroy themselves. And so the platelet count is an important test when somebody is infected with dengue, because there have been reports of cases where the platelet count has fallen to as low as 3 or 5,000, where the normal count should be at least 150,000. So first of all, why does the platelet count fall in dengue? Well, the dengue virus is an arbovirus, and one of its effects is to cause a suppression of the manufacture of platelets in our bones. All our red blood cells, white blood cells, and other cells in the blood like platelets are actually manufactured inside our bones. And these viruses like dengue cause the bones to stop making these cells. So together with platelets, other cell counts would also fall. Not only that, but dengue also, the dengue antigen, which is NS1, it actually triggers a cycle inside platelets which causes them to destroy themselves, which is called apoptosis. So dengue has a pretty negative effect on platelets, and this is one test whose value is always watched when someone is diagnosed with dengue. So what are the normal ranges of platelets? In normal human adults, the platelet count should be between 150,000 to 450,000. What happens to platelets usually in dengue is that the number will fall below 150,000. This is the cutoff at which the WHO recommends that attention is paid to the platelet count. If it stays above 150,000, and even if you have dengue, they won't give it much importance. The minute it falls below 150,000, importance is going to be given, and this is an important sign to then track in case of your dengue fever. Now, what are the different grades of reduced platelet count? So between 100,000 to 150,000, we consider it to be mildly reduced. Between 50,000 to 100,000, we call it moderately reduced. Between 20,000 to 50,000, we call it severely reduced. And numbers below 20,000 are considered to be critical. And 20,000 is usually, traditionally, historically, the number at which the doctors would recommend that you should receive a platelet transfusion. But I'm going to go more into detail on that in the subsequent slides. What normally happens in dengue patients is that the counts will usually fall below 100,000, which is 1 lakh per cubic mm. This is normally seen in most dengue patients, but they do recover. Severe cases of dengue can cause the platelets to even drop below 5,000 or up to 5,000. Now, a lot of people wonder whether the reducing number of platelets is what is dangerous in dengue, but the truth is that the reduced number of platelets are not actually dangerous. And the reason for this is that the real problems or the real chances of severe complications in dengue, whether dengue becomes really serious, is not because the dengue causes the platelet numbers to fall, but because there is an injury that takes place inside the inner lining of our blood vessels, which is also caused by the dengue virus. And this is the thing which actually causes the real danger in dengue. In most cases, this is also seen together with low platelet counts, and so platelet counts can be used as a marker to trace the severity of dengue rather than themselves being the thing which is dangerous. So what are the signs that we look for to check whether dengue is in itself becoming dangerous, which would be obviously associated with low platelet counts? So here I've listed those signs because these signs are important in the context that even if your dengue platelet, if your platelet count is say between 100 to 150,000, or let's say it's 70,000, but we start seeing some of these signs in your case, that itself is considered to be a very dangerous thing, and you will need to be immediately admitted if such signs are seen, even if your platelet count is not considered to be severely reduced. So what are the danger signs that we also look for together with low platelet counts? The first and foremost is severe pain in the stomach. You seem to be constantly vomiting. The vomiting doesn't stop. You're throwing up all the time. There is a buildup of water in your chest or your stomach. In medical language, we call this pleural effusion or ascites. There is a sudden bleeding from your nose, from your mouth, or from under the skin, anywhere in the body, inside the stomach as well. There's extreme weakness or fatigue. You feel extremely tired all the time, or there is a swelling of your liver. If we see any of these things, irrespective of your platelet count, you need to get admitted and evaluated immediately. So now let's discuss specific platelet counts and whether they are dangerous. Let us say that your platelet count is between 100,000 to 150,000. Is this considered dangerous? Now, first of all, this is considered to be a warning sign or a cutoff as per the WHO. Anything below 150,000 and the WHO calls this as a warning sign. So that's the first thing you should know. The second thing is, this is something that you're usually going to see between the second to the fourth day of your dengue fever. It will probably be followed by an even further drop in the platelets. The third thing is that if your count is between 100 to 150,000, you just need to follow up every day and keep track of your platelet count as well as your other parameters. Most of the times the doctors will not ask you to get admitted for this. They won't probably even start you on any kind of blood transfusion. It's just something where you need to be alert, because it's very likely that the count is going to fall more, but by itself a count between 100 to 150,000 is not considered to be dangerous. Okay, now let's look at the next segment, which is between 50 to 100,000. This is called moderately reduced number of platelets. So is a count between 50 to 100,000 considered to be dangerous? Now this, according to the Indian research, is considered to be a sign of dengue hemorrhagic fever, which is an advanced or furthered state of dengue, which is definitely dangerous. So a count between 50 to 100,000 together with other signs, like first of all, there are going to be signs of bleeding, which are red spots on your skin, bleeding under the skin, bleeding on pressing the skin. For example, if somebody ties a tourniquet or a belt around your arm and just tightens it, there might be small bleeding spots which appear all around. This is not a good sign. There may also be blood in your stools. Your stools may show blood in them. They may be black because of the blood, or there might be blood in your vomit as well. All these are dangerous signs. If these are seen together with a count between 50 to 100,000, this is definitely very dangerous and a cause of concern. Together with these, we also look for water in your lungs, which is, as I told you, called pleural effusion, or around the stomach, which is called ascites. All these are dangerous signs. If seen together with a count from between 50 to 100,000, you have to be very careful. Some doctors might even advise that you do consider admission based on this. It is important that if your count is in this range, you should be very carefully monitored. You have to do other tests like your liver function test, your CBC, as well as your platelet counts from time to time, and you should consult your doctor. So if your count is between 50 to 100,000 platelets, what do you actually need to do? Well, you don't always necessarily need to get admitted. It depends on other signs as well, and your doctor will take this decision. It could be considered dangerous, but it depends on all the signs that I already listed. Which are some other tests that you can do? There's a test called the immature platelet fraction, which is basically the number of platelets out of the total platelets that we consider as newly manufactured platelets. So the immature platelets, these are young platelets, they have just been made, and if this percentage is more than or equal to 8%, it is usually considered a good sign. It means that your body is now producing new platelets, and slowly over time your platelets will start rising. Together with this, you must also do another test called the hematocrit. This is usually a part of the complete blood count, and this parameter has to be very closely watched if your platelet count is between 50 to 100,000, because any change in this parameter could either tell us that you're suddenly worsening or that your condition could be improving. So the hematocrit is another important test that you should do if your platelet count is between 50 to 100,000. Now let's look at the count between 20 to 50,000. This is considered to be as a severely reduced number of platelets. Is this level dangerous? Now, without even getting into it further, anything below 50,000 is dangerous. It really doesn't matter whether you have other signs, whether you don't have other signs. 50,000 is considered to be a pretty critical number. Anything below 50,000 is dangerous, and you have to talk to your doctor before you think of doing anything else. Now, that said, there are other important signs that your doctors are going to look for. For example, even if you don't show any of the other dangerous signs that I already mentioned and your count has gone below 50,000, doctors might just get you admitted anyway in case you are above 60. Let us say you have other comorbidities, like you have high blood pressure, you have an existing heart condition, you're a diabetic, you have a kidney problem, you may be already having some liver problems. If you have any other comorbidities together with a low platelet count, you are going to be a candidate for getting admitted. Together with this, any other warning sign that is seen, and they will admit you immediately. Not only that, but this is also the level at which doctors could start considering platelet transfusion. So what is platelet transfusion? Is basically where you receive a transfusion, which is something which is contributed by a donor of platelets, so that your platelet numbers increase. Some doctors will even start platelet transfusions at or below a level of 50,000. Some will wait for the level to go below 50,000 and see some signs that there is some bleeding taking place on its own, like I've already listed, and based on that they will start the platelet transfusion. But by and large, anything below 50,000, most doctors are going to ask you to get admitted. Some will even start a platelet transfusion. You have to be kept under constant watch. All your vitals have to be monitored. All your other tests have to be done, like your hematocrit, your liver function tests, your other critical parameters, your oxygen level. All these things will be checked. 50,000 is not a level at which any doctor is going to take any kind of a risk. So please consult your doctor also. This is not something that you look for on a YouTube video, but this is just general information. Now let's look at a level between 10,000 to 20,000. Let's say your platelets are 15,000, and you have dengue right now. So what is it dangerous? It is extremely dangerous. Every single person whose platelet count has gone to this level should ideally be admitted. Every doctor will probably ask you to get admitted. There's no question about that. Most doctors would also start a platelet transfusion by now, because any value below 20,000 has historically been considered as a point at which doctors start transfusion for platelets to shore up your platelet numbers. The thing is that whether transfusion of platelets helps or not is in itself a controversial subject. Studies have shown that people who receive transfusions actually take longer to recover. Their platelet numbers take longer to recover. Some say that it is a prophylactic or something that we do to stay on the safe side. But at this level, admission is almost a must. Transfusion is almost always a must, but your doctors will take that call. Now, whether or not you will start seeing bleeding from your nose, bleeding from your mouth, bleeding from other body cavities is not sure. Many patients don't show any bleeding even at this level, and the real danger at this level of platelets is actually, like I mentioned before, that there is damage to your blood vessels. It's not the reduced platelet numbers themselves that are risky, but there's damage to other blood vessels in your body, which could cause fluid to leak out of the blood vessels and into your other tissues, which can then become a problem. But by and large, anything below 20,000, very dangerous. You got to make sure that you are in the right hands when this happens. Now let's look at the last category. Let's say that your platelet count is between 5 to 10,000. What should you do? Now this is extremely dangerous. We call this critical. Actually, anything below 20,000 is critical. Below 10,000, very dangerous. You need to get admitted. You will probably be placed in the ICU. Doctors will probably start transfusion whether or not you're showing any signs of bleeding from your body. Other than this, the good news is that a lot of patients have survived even with such low platelet counts. There are case reports of people surviving even with a platelet count of just 5,000. So that is not something that you should worry about from that point of view, because there have been case reports. Other than that, they will check your vitals every 30 minutes. When somebody's platelets are so low, 30 minutes, 5 to 30 minutes is actually the duration. You will expect some nurse or someone to show up by your side every half an hour at minimum to check all your vital signs. They're going to continuously do all your other blood tests, like your hematocrit, which is very critical to be checked, immature platelet fractions, liver function tests, your kidney function tests, all your other vitals, your blood pressure, your pulse pressure. All this stuff is going to be constantly checked, and you will be monitored virtually on a minute-to-minute, hour-to-hour basis. So this is a very dangerous level. You have to be in a hospital with a doctor, consulting a doctor. Please don't look at YouTube videos for this information. This is only for educational purposes.